Hey everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Melissa. I am a registered nurse, and this is the Lucky Nurse Lectures. So in this nursing maternity lecture clip, we are going to be covering the different signs of pregnancy. So first off, I want to say pregnancy in the nursing world is looked at very differently than pregnancy in the real world. In the real world, a woman would presume that she's pregnant or think that she's pregnant. She'd go and get an at-home pregnancy test and take that. If the pregnancy test says that she is positive, then she is positively pregnant. If the pregnancy test says that she is negative, then she is not pregnant. Well, in the nursing world, it's a little bit more complex than that. We base positive pregnancies off of signs, which we call signs of pregnancy. And those signs can be divided into three different categories. The first category being presumptive signs of pregnancy. The second category being probable signs of pregnancy, and then the third category being positive signs of pregnancy. So as I am filming this clip, I am pretty well into my first trimester of pregnancy. I'm pretty confident that I am pregnant. However, under the nursing world, I would fit under experiencing signs and symptoms of probable pregnancy. So technically I am probably pregnant, which sounds really weird to say because I know that I'm pregnant, but we're going to get into the signs underneath each category so that you can understand. So under presumptive signs of pregnancy, we have symptoms including fatigue, nausea and vomiting, amenorrhea, which is a lack of a period, urinary frequency, and quickening, which is a term that we use to talk about like slight fluttering movements. The thing about quickening is that you typically will not feel it, or a woman will not feel it in her first trimester. It's typically something that's felt between 16 to 20 weeks of pregnancy. But quickening is still a presumptive sign of pregnancy. Some people are unaware that they are pregnant until they are well into their second trimester. Now, the next category is probable signs of pregnancy, which I fall under right now. And probable signs of pregnancy are a little bit more concrete than presumptive signs of pregnancy, but they're still not completely definitive. It's kind of like this middle area between a presumptive pregnancy and a positive pregnancy. So signs under a probable pregnancy include Godel's sign, which is like a softening of the cervix, Chadwick's sign, which is a blush appearance of the cervix, so it's changing in color, Braxton Hicks contractions, which we talk about a lot in nursing school, palpitation of a fetal outline. So if you're able to actually palpate a woman's stomach and feel an outline of a fetus, that is a probable sign of pregnancy. And then we have ballurement, which is a tapping on the cervix during a vaginal exam. So when a woman goes in for a vaginal exam, the doctor will be able to feel this. And then lastly, we have a positive pregnancy test. So it may seem like a positive pregnancy test would fall under the positive signs of pregnancy, but it does not. And I know that this is something that gets nursing students confused oftentimes on the NCLEX and on exams. So a positive pregnancy test actually falls under the category of a probable pregnancy. And then the last category of signs of pregnancy that we have would be a positive pregnancy. So this is an undeniable, unmistakable signs that a woman is pregnant. And signs that fall underneath this category would include fetal movements detected by an examiner, visualization of the embryo or fetus. So when you go in for an ultrasound, if you and the doctor can actually see a fetus, you are positively pregnant. And then last, auscultation of fetal heart sounds. So if the physician or a nurse were to take a stethoscope and to auscultate a woman's abdomen, if they can hear that fetal heartbeat, that is a positive sign of pregnancy. So this quickly sums up the different signs of pregnancy and the different categories that they fall under. Hopefully this clip helped you.